Duetact is a combination of two drugs, pioglitazone and Glimepiride. It is used with a proper diet and exercise program to control high blood sugar in patients with type 2 diabetes. This helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk of a heart attack or stroke. Pioglitazone helps to restore your body's proper response to insulin, lowering your blood sugar. Glimepiride causes the release of your body's natural insulin. It's important to talk to your doctor about the risks and benefits of using pioglitazone-containing products. The recommended daily dosage of Duetact will be determined by your doctor based on your condition. It is usually taken once daily with the first main meal of the day. Before starting Duetact, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth once daily with the first main meal of the day. The dosage will depend on your medical condition and response to treatment. If you are taking Colesevelam, make sure to take this product at least 4 hours before taking Colesevelam. It's important to use this medication regularly to get the most benefit from it, and try to take it at the same time each day. Monitor your blood sugar regularly and share the results with your doctor. It may take up to 2 to 3 months before you get the full benefit of this drug. When switching to this combination product, your doctor may ask you to check your blood sugar more often to make sure you do not have a sudden attack of low blood sugar. Be sure to follow your doctor's directions carefully. Common side effects of Duetact may include headache, dizziness, diarrhea, nausea, muscle pain, sore throat, or tooth problems. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as vision problems, bone fracture, reddish-colored urine, urgent need to urinate, signs of liver disease, mental/mood changes, seizures, easy bruising/bleeding, or signs of infection. Duetact can also cause low blood sugar, which may result in symptoms such as cold sweat, blurred vision, dizziness, shaking, fast heartbeat, headache, or fainting. It's important to carry glucose tablets or gel to treat low blood sugar, and to consume a quick source of sugar if needed. Be sure to eat meals on a regular schedule to help prevent low blood sugar. Additionally, if you experience symptoms of high blood sugar, such as increased thirst and urination, notify your doctor right away. It's important to be aware of potential allergic reactions and seek medical help if you notice any symptoms of a serious allergic reaction. Remember that this is not a complete list of possible side effects, and be sure to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Pioglitazone, the main ingredient in Duetact, can sometimes cause or worsen a specific heart problem called heart failure. If you experience symptoms such as shortness of breath, swollen ankles or feet, unusual tiredness, or sudden weight gain, it's important to notify your doctor immediately. It's also important to note that this medication is not recommended for individuals with certain types of heart failure. Be sure to inform your doctor if you have heart failure before starting Duetact. Always follow your doctor's directions and recommendations for taking this medication, including the daily dosage and the optimal timing for taking it. Before starting Duetact, make sure to inform your doctor or pharmacist if you are allergic to pioglitazone, Glimepiride, or other similar medications. It's important to discuss any medical history of heart problems, fluid retention, liver or kidney issues, hormonal conditions, anemia, eye problems, bladder cancer, or other health concerns. Be cautious of potential side effects such as blurred vision, dizziness, or drowsiness due to low or high blood sugar. Avoid driving or operating machinery until you are sure you can do so safely. Limit alcohol intake as it can increase the risk of low blood sugar. Take extra care when your body is stressed, as it may be harder to control your blood sugar. Additionally, be mindful of the sun, as this medication may make you more sensitive to sunlight and increase the risk of bone fractures, especially in female patients. Older adults may be at a greater risk of low blood sugar while on this medication. It's important to discuss reliable birth control options with your doctor, as Duetact can cause changes in the menstrual cycle and increase the risk of becoming pregnant. If you are pregnant, discuss a plan with your doctor for managing your blood sugar, as the medication may need to be switched to insulin at least 2 weeks before the expected delivery date. It's also important to note that it's unknown if this medication passes into breast milk, so it's advisable to consult your doctor before breastfeeding. When taking Duetact, it's important to be aware of potential drug interactions. Certain medications can affect how Duetact works in your body, so it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, other medications, such as gemfibrozil and rifampin, can affect the removal of pioglitazone from your body, which may impact how Duetact works. Beta-blocker medications may also prevent the fast/pounding heartbeat typically associated with low blood sugar, so it's important to monitor your blood sugar regularly and communicate any changes to your doctor. It's also important to note that many drugs can affect your blood sugar levels, so it's crucial to discuss any medication changes with your doctor or pharmacist. Regularly checking your blood sugar and promptly informing your doctor of any symptoms of high or low blood sugar is essential. Your doctor may need to adjust your diabetes medication, exercise program, or diet. If someone takes too much Duetact and experiences severe symptoms like passing out or difficulty breathing, they should call 911 immediately. Otherwise, they can contact a poison control center. In the US, residents can call 1-800-222-1222, and in Canada, they can call their provincial poison control center. Symptoms of overdose may include shakiness, fast heartbeat, sweating, and loss of consciousness. It's important to seek medical help right away if an overdose is suspected. It's important not to share your Duetact medication with others. To effectively manage your diabetes with medication, diet, exercise, and regular medical exams, consider attending a diabetes education program. In addition to taking Duetact, it's beneficial to make lifestyle changes that promote healthy bones. This includes increasing weight-bearing exercise, consuming well-balanced meals with enough calcium and vitamin D, quitting smoking, and limiting alcohol. Talk to your doctor about the possibility of taking calcium/vitamin D supplements and other lifestyle changes that may be beneficial for you. While taking Duetact, it's important to undergo lab and/or medical tests to monitor kidney and liver function, fasting blood glucose, hemoglobin A1c, and complete blood counts. Make sure to keep all medical and lab appointments and check your blood sugar regularly as directed, sharing the results with your doctor. If you forget to take a dose of Duetact, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to store Duetact at room temperature, away from light and moisture. Make sure to keep it in a place that's not in the bathroom, and always keep it out of reach of children and pets. When you no longer need Duetact or it has expired, it's important to properly discard it. You can ask your pharmacist or local waste disposal company for the best way to do this. Remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.